So I jumped into Autocart out of necessity, candidly. It wasn't called Autocart back then, but it was something that Arthrex gave as an opportunity for us, frankly, from an innovation standpoint, to treat things that we couldn't treat before. I started using it in the hip, oddly enough, only because there were cartilage defects in the acetabulum that were just not able to be treated arthroscopically. And then as a result, we had to do a surgical dislocation, which is a really morbid procedure.
Mm-hmm.
And I said that there has to be a better way than this. This is an absolute disaster having to do this to patients. We kind of worked with the folks here that were amazingly helpful in that regard to harvest the cartilage from the femoral head, which we effectively remove anyway at the time of the osteochondroplasty, but instead to harvest it. And they developed GraftNet to do that, which GraftNet, just as I'm sure you all know, but it's effectively a very simple but fascinating device that sort of attaches to your shaver, and it captures the cartilage as you're removing it in a very simple fashion. I'm not a particularly good surgeon, so they have to give me instruments that make me look good, and that is one of them. So it catches all the cartilage, and then you can use that on the back table, and it's harvesting the patient's own biology. Admittedly, I did it without a lot of evidence to support it at the time, and that's not usually the way I approach things. I work in academic medicine, so for me, evidence is king. So I figured I needed to put some data to that. So we harvested the cartilage, and then we combined it with, at that point, whole blood. That really was sort of a bobbing and weaving such a scenario in the OR, to be totally candid with you, and then transplanted it back in. And again, prior to thrombinator, we actually just used Vibrant glue and sort of glued it in, and I crossed my fingers because I didn't know what else to do. And the patient did really well. Autocart, to give you an overview, is basically harvesting the patient's own cartilage from areas they don't typically need it. For me in the hip, it's on the femoral head-neck junction, where the cam deformity is, but you can also do it in the knee, where you guys know very well, where you used to take Oates plugs. So right in the notch or the far peritrochlear zones, and you harvest it and then you transplant it back in, and it's effectively a cellular scaffold, and it does incredibly well.